Hi everyone, welcome back to my health access channel. My name is Arroyo. Today I'm going to be showing you guys how exactly to apply for Medicaid, who qualifies and what it covers, so you can make informed health decisions. So with that being said, let's get started on your journey, understanding how to apply for Medicaid and an easy enrollment guide to do so. So what exactly is Medicaid, you might ask? Medicaid is a public health insurance program that's designated to help low-income Americans to get the health care that they need. It's funded by both federal government and individual states, and every state takes part of this program. Medicaid mostly focuses on vulnerable groups. For instance, they focus on children, pregnant women, adults with low income, and seniors as well. What's really important to understand is just how many children actually rely on this program. A huge and large percentage of children in the U.S. rely on their health care through Medicaid. It also supports many non-elderly adults living with disabilities who might not be able to afford care otherwise. And for seniors, especially low-income seniors who need long-term care or nursing home support, Medicaid is often their main lifeline. So overall, Medicaid plays a crucial role in making sure millions of people across the country have access to healthcare when they otherwise might not be able to afford it. Okay, real talk here. Getting healthcare in the US can feel like trying to beat a boss in a video game with no power-ups. It's stressful, it's confusing, and it's like, why does it cost more than rent sometimes? But that's exactly where Medicaid comes in. Think of it kind of like a cheat code for healthcare, for those who need the support the most. So let's break it down. Who really qualifies for Medicaid? But let's make it simple because nobody really has time for government speak right now. So first and foremost, it's going to be low income. Medicaid is for low income individuals and families. They look at how much money your household makes, how many people are in it. The bigger your family, the more help you might qualify for. Next, your category. Kids, being pregnant, people with disabilities, and many adults who just don't have the income to afford care. All qualify. Medicaid is especially clutch for folks who need long-term care for or have disabilities. And then for the third one, it's important to know where you'd have to apply. You have to apply in the state that you live in, because every state does Medicaid a little bit differently. And fourth, the citizenship rules. U.S. citizens are covered. Certain qualified immigrants can be too. Even if someone doesn't qualify for full benefits, Medicaid might still help with emergency services. Healthcare doesn't just stop because paperwork is complicated. Okay, so let's break down what Medicaid actually gives you, because it's a lot more than people. If you got Medicaid, you're covered for the basics and the big stuff. For instance, doctor visits, whether it's a checkup or you're actually sick. Also, primary care, you go to the doctor, keeping your health long-term healthy. Also, hospital care, both inpatient and outpatient. Surgeries, yep, the expensive stuff. Emergency care, because life happens. And then lab tests and x-rays, so they can actually figure out what's going on. And then there's more. Prevention care like vaccines plus screenings. It's catching the issues earlier on, which is key. Prescriptions without draining your wallets. As well as transportation to appointments. A lot of people don't have cars, so then that's also covered, which is really great. Family planning, resources to help plan your life, as well as EPSDT, full benefits for everyone under 21, keeping kids plus teens healthy. Basically, Medicaid is like a friend. It always has your back when you're healthy, when you're struggling, and especially when things get scary and expensive. Now, let's actually talk about how to actually apply for Medicaid, because this is where a lot of people get stuck, but I'm here to make it really simple for you guys. I also wanted to add in there that I know a lot of us experience having technical issues with computers, and we're not all computer experts, but thankfully so, it is user-friendly and there is help if needed. There's county workers and community organizations that can assist you for free. And that's pretty much it for applying. There is no tricky questions. The goal is just basically to figure out your situation and your income so they can help you immediately. After you submit your information, the system will check your availability right away. And if you qualify, you're covered. Sometimes coverage can even begin immediately for urgent needs. Another great thing is that many people are able to get retroactive coverage. This basically means that Medicaid can cover bills that you had 3 months before you applied, but you just have to be eligible during that time. This can be a huge relief for many families that have medical bills that they need to pay or unexpected medical emergencies. So after the whole process, once you're accepted and approved, you'll get benefits cards in the mail, and you can start seeing doctors, specialists, and getting prescriptions filled, often with little to no cost. So really, applying for Medicaid is one of the most powerful steps you can take to protect your health and your wallet as well. And I'm here to help you guide through every step of it. So here's why Medicaid is literally a lifesaver for millions of people. The chart shows exactly who relies on Medicaid. And it's not some tiny group. We're talking about low-income families, pregnant people, folks with disabilities, basically people who really need the support. So check this out. 83% of children below the poverty line are covered by Medicaid. Like, imagine if those kids were not able to get Medicaid or health care. That's a huge deal. Medicaid also helps almost half of all pregnant people, making sure they can get care before and after giving birth. And it's a major lifeline for disabled adults and seniors in nursing homes who often can't afford care on their own. So instead of thinking Medicaid is just another government thing, the chart shows what's real. Medicaid is a safety net that keeps millions of people healthy, protected, and not drowning in medical bills. It's really helping the most vulnerable groups in our country survive, and it actually gets the care that they deserve. And the most important part of this message is that I want to leave with you guys today that you guys have access to affordable health care. Open enrollment runs from November 1st through January 31st. And often the state gives a grace extension, so don't wait until it's too late. Medi-Cal and Covered California use the same application, which means you only have to apply once to see which program can help cover you and your family. And if you have a big life change, like for example, losing insurance, having a baby, or changes in income, you can apply any time of the year. Coverage usually starts on the first of the month after you pick a plan. So taking action now can get you covered very quickly. You deserve to make informed decisions about your health and your future. And with Medicaid, you can get the care you need without worrying and the cost. So take the step. Get covered, stay healthy, take care of yourself, and take care of the people that you love. To wrap this up, Medicaid is honestly one of the biggest safety nets we have in the U.S. healthcare systems. Like, imagine being sick or needing a doctor and not being able to afford anything. That's really the reality for millions of people. And Medicaid is one of the reasons so many of them still get care. We saw how huge the enrollment really is and who really needs or depends on it. For instance, low-income families, kids growing up in poverty, pregnant people making sure their babies are taken care of and born healthy, people with disabilities who need ongoing support as well. These aren't small groups. This is our community. These are real people that actually need this support and help. But I would like to add, one of the coolest part of it all is that you don't have to be an expert to apply or to get covered at all. Just having the basic knowledge of who qualifies and where to apply can change literally someone's life. Access to healthcare shouldn't feel like luxury. It should feel normal. It should be simple, and programs like Medicaid are exactly what people need. So, after seeing all this data and all this information, I hope we can all walk away from this gaining some information and feeling more aware and more empowered. Helping someone get healthcare isn't just filling out a form. It's helping them protect their future. And at the end of the day, Medicaid keeps people alive, healthy, and able to show up in the world. And if we can even help out one person to understand their option, that's honestly a win for me. I also wanted to add in that down below, you guys will be able to see the reference links where the data was all collected from, so you guys can take a look into that as well. And once again, thank you guys for tuning in with Mia, your health access channeler. Thank you guys.